Hello and welcome to today's webinar, a part of our series Advice and Perspectives from Friends of UConn, where UConn Center for Career Development will bring guests to you to talk about the career journey in these tumultuous times. We're planning a mix of alums and experts on starting, restarting, and surviving career-wise in this economy. My name is Lisa McGuire, and I'm here with the UConn Center for Career Development. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You should see the attendee interface on your computer desktop in the upper right corner. You're listening in using the computer speaker system by default. If you'd prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. Today's webinar is designed to be interactive with a Q&A format. I will ask Dr. Melendez Rhodes some prepared questions, but the value of this session is to have your questions answered. Please type your questions into the questions pane of the control panel. We encourage you to do that at any time during the presentation, and we'll address them throughout. Note that today's event is also being recorded and will be provided to you within 48 hours. With that out of the way, let's get to the reason we're all here. Please let me introduce our guest, Dr. Tatiana Melendez Rhodes. Dr. Rhodes is an assistant professor and clinical coordinator of the Marriage and Family Therapy program at Central Connecticut State University. She's a licensed marriage and family therapist in Connecticut, a clinical fellow of the American Association for Marriage and Family Therapy, an AAMFT approved clinical supervisor, and a former Fulbright scholar. She received her master's and doctoral degrees in human development and family studies with a specialization in marriage and family therapy from UConn. She also worked as a psychologist in Peru. Dr. Melendez Rhodes has taught at universities in the US and in Peru. She's presented her research in national and international conferences and published scholarly work in peer-reviewed journals. Welcome, Dr. Melendez Rhodes. We're so glad you can join us today. Can you spend a few minutes telling us about yourself beyond the bio that I just read? I understand you earned your bachelor's degree in Peru and came to the States and UConn for post-grad work during the downturn in the economy, and you came back and forth, did some work on both sides, and you've been in several universities, so we'd love to hear more about that.
Hi, thank you so much for inviting me, for having me here. It's a pleasure for me to interact today with you and the students from UConn, my alma mater. So yes, so I'm a marriage and family therapy, and I came here to the United States in 2003 with a Fulbright scholarship. So I went to UConn, and I did pursue my master's for a couple of years, and then I went into the doctorate program. It went like 7 years. At that time, I had the opportunity to do a doctoral fellowship in Oregon, and so I spent some time there prior to graduating from my PhD. I had the opportunity to do research. I had the opportunity to teach and to get much more experience in graduate school. So then I graduated, and in Oregon, I was working as well as a clinician. But then I went back to my country. I'm originally from Peru because I was with a Fulbright scholarship, and so I had to go back to my country and stay there for almost 2 years. And after those 2 years, so I came back to Oregon again, and I continue working and doing different things for my career. But I always wanted to be a professor, so that's what my heart was, and actually that's where I pursued the PhD. And so I was looking for a job, and I got a job here in Connecticut, so that brought me back to Connecticut. Yes. So I was here in Connecticut. I've been here in Connecticut since 2014, working at Central in the Marriage and Family Therapy program. So we are working with master students who are going to become marriage and family therapists. So I've been, while I was in Peru, during those 2 years, I was working also at 3 different universities. Again, you know, I always felt really good about teaching, and I wanted to interact with the students and be in the world of academia. So that's what I was doing prior to coming here. But before I came to the US, I was a psychologist. So I was working as a psychologist there for a while in Peru. So I came with a whole career already and started at UConn as a marriage and family therapy. Back then, we didn't have a place in Peru to specialize in marriage and family therapy. There was not such a place. We didn't have a master's or a doctorate in marriage and family therapy. So we were more focused on psychology. But the work in psychology was more individual oriented. And I was more interested in the work with couples and the work with families. And I wanted to have a good foundation and actually a training and a certification for that. So that's what's made me apply to a university in the US. That's in a nutshell.
Well, that makes sense, because I was going to say, what made you come to the US? That makes perfect sense. But you did bounce back and forth. And I'm wondering, did you ever feel that you needed to take a pause? And did being an international student in the US have any effect on whether you thought you could take a pause? A lot of our people and the folks in the audience are international students and or doing in the midst of research right now. So, and some of them are thinking about pausing. Is there a difference between being an international student and not, and taking a pause, or what are your thoughts on that? And did you ever experience that yourself?
Yes, that's a very interesting question. I mean, I thought about many times, and just, how can I slow down a little bit? How can I, there are so many things. First of all, when I came here, English is not my first language, right? So I was so used to speaking Spanish, so used to learn everything in Spanish. I remember my first semester at UConn taking that many classes and me falling asleep immediately because I was so overly tired of reading. We had a lot of reading to do, but reading was not the problem, but my brain was trying to adjust to that space, right? So I got really tired. And so, as it started getting better as I, progressed with my studies. But then it came a point in which, I have so many responsibilities, so many commitments, because the audience, the students might know that when you're in graduate school, it's just your time that you need to take advantage of all the opportunities that you have. We want to make sure that by the end of our studies, we have some publications, we have some things on the pipeline, we have presented, we are collaborating with professors, because we need to have references for looking for a job eventually. So sometimes, this different kind of variables that not allow you to take a break and say, this is, I will do that. As an international student, I had also the difficulty, that I had a period of time in which I needed to accomplish everything. And that's kind of like feeling under pressure. So I couldn't say, like, for example, okay, I'm gonna go home for a year and then will I come back, when my home is in another country or was in another country. If I left, was I gonna be able to come back? It was not gonna be seen as I'm taking a break. It was gonna be seen, well, she abandoned it, maybe. So the meaning could be different for somebody here than for somebody who is international. Also, the visa status, right? So we have different kind of visa status. So some people are in the J1 or F1. Like I was under a visa which I was not allowed to work outside of the university. So if I didn't study, I was not able to live outside of the university. So it comes all these different kind of pressures, that when you think about it, your body's telling you, we need to, take a break or something, but your mind is telling you, you cannot afford to do this. There is no time, which causes a lot of stress, no? But there are many things that we can do to feel better.
Right. And I imagine layering on that, both the pandemic, the situation with the pandemic, as well as immigration status, makes it even worse for current international students, even worse than when you were there. And can you come back? That question. Um, so
Yes,
it must be even
yes.
harder. So we have a question from one of our viewers who is currently taking a break. Now, some students do have no choice, right? Some students, it's an economic situation, or the online, working online and trying to get this done, or maybe their research has been canceled, so they're being forced to take a break. But this questioner, so I want to address that, but this questioner is saying that they are taking a break, and they're looking for some strategies for ramping up after the break. They're feeling overwhelmed by imposter syndrome that that their break means they're not able to perform at the same level. So they're concerned about ramping back up. So does this break, what can they do during this break to make sure that they're keeping up and keeping their skills up and ready to jump back in at the same pace?
Okay, thanks for the question. Uh, there are different things that we can do, no, but I think that it's very important to understand the dynamics, that we are experiencing. There is a before and after of what we are used to do. Like in academia, being a student or being a faculty member, we play different roles and we go through different kinds of stresses. For all of us, there has been a parenthesis in our professional work somehow. That is going to have an impact in ourselves, an impact in our relationship, and an impact as a professional or soon to be professional, right? So for some people, there has been a graduation issue or conference has been canceled or the research has been canceled or conference has been postponed. That's going to have different kind of impact, like for example financial situation. There are some students, for example, who are dealing not only with the impact on the research of their study, but also the impact on their own relationship with others, meaning family, children, spouses, etc. One of the things that we need to understand is like when we are still at the university, everything is about productivity. We don't stop for a moment to kind of like screen ourselves how we're doing. We are on the go all the time. And now this put us a sudden stop, the break came and here it is, what am I gonna do? So one of the things that I want to tell people today is that that creates a loss of control. We are used to we live in a culture in which we are used to control, manage, predict, and work based on our plan. So now there is a lot of uncertainty, and uncertainty crisis create a lot of stress. So some people are going to pass, for when they experience that, but other people are going to try to move forward, but in the best way they can. It's important to understand that all of us, we have different ways in how we manage this, and there is not the better or the worse. It's just each of us have our own pace, and we have to respect that. Um, as I said, one of the first things is to recognize ourselves. What is triggering me now? I have to be able to recognize my own emotion. So what kind of emotion I experience? For the most part, it's I know that my research has been canceled. It's I know that I cannot go to my lab to work. It's I know that I cannot continue collecting my data, or that I don't have enough data to run the analysis, or maybe I don't have access to a specific literature, or I was gonna do my interviews in person, and well, I cannot do it online because it's not the same, so on and so forth. So I experience anger, I experience frustration, right?
Yeah.
And I had to see, so what is happening in my mind? And we have to be very careful about this. What's going on for me when all of this thing happening? We have to be very careful with this cognitive distortion somehow. Like, am I good enough? And I'm gonna be able to find a job? You know, it's my fault that I didn't collect my data earlier. My career will stop, or my career won't be the same. I won't be as successful as I planned that I was gonna be. So all these ideas, what is that is that it keep us in the paralysis mode, you know? But it's somehow a little bit normal, because it's somehow a little bit normal to feel this way at the very beginning. But then after I recognize those emotions, you know, I have to accept, is this really my fault? Most of the time, the answer is no. And in this particular case, it is no. So that I'm taking that responsibility outside of me, you know, and having all this feeling. And I got to being able to accept that I won't be able to change this. It doesn't matter how angry I feel. It doesn't matter how frustrated I am. However, what I'm able to do is to become a little bit more stronger and perhaps change, you know, look for some change, adjust, be flexible. This is a perfect time to be creative. All of us who have gone through this path, you know, then taking a master's, going to a PhD, it hasn't been easy. It has been really hard. And I invite people to think, at what time in my life, in my academic career, I felt that I was not going to be able to finish something, that I was not going to be able to pass a class, that I was not going to be able to publish something. And I was able to do it in the end. So revise, you know, try to review those skills that perhaps have been hidden as you have been, you know, going and advancing and becoming, you know, a person who is close to graduate. So you're going to find there some resources. But at the same time, this is the time in which, what skills do I need to develop? One of the things that I would recommend people to do is to look at your resume. There's always sometimes things that we want to improve. You know, there's always sometimes, like for example, specific areas that we want to learn more about, you know, and I think it's very important to be very intentional and plan for doing that. For example, now there are several webinars, there are courses online, there are things that we can do. Look at your research, for example, and yes, one of the research might be, you know, canceled, or perhaps this temporarily has been stopped. But all of us, we always have things on the pipeline. So there's always this article that I wanted to write, and I have not had the time to do it. Maybe it's time for me to focus on that specific article. Look for further collaboration, network with people. You can contact, for example, previous people that you have worked with, and expand your research. Look at your research from a different perspective. Talk to your advisor about it, you know, so is this possible? What am I missing here? You know, sometimes when we had a little of extra time, we would have said, if I had had the time, I would have done this, fill in the blank, right? So, well, this is the time to do that. You know, now that it's, and I know that not everybody had a lot of time in their hands, because, you know, people are homeschooling children, or you have another job that you are doing, or you have different kind of responsibilities. But in that specific amount of time that you might have, you know, think about that. What am I gonna do that is gonna put me in a better position, and it's gonna make me more competitive? Because your life cannot be summarized only to one specific thing, you know. So you have other skills that you can develop. It is coming back to the emotions. I think it's very important to address the emotional piece and the cognitive, and see how we are thinking about ourselves, because in some way, if we restructure that, you know, it was going to help us to actually move forward. It will help us. This is not my fault. I am not less than somebody else, or being comparing ourselves with other people. But this person graduated, this person finished research. Yes, that's not my case right now, but I will be able to get there. I can do other things in between. I can get more skills. How am I going to be more productive? Perhaps your habit needs to change, you know, instead of eating, or for example, eating or doing exercise, relaxation techniques, breathing, meditation, reading something that's feel better during the day. This one of the things. There are other things too, but I want to listen from the question that you might have.
Yeah, sure. Well, thank you. That's a lot, and I think you made some really good points. Reach out to others. Think about some of the past research you've done, and if I'd had more time, what would I have done differently or more? So that is going to keep you on top of your game in terms of research. I think those are some great suggestions. Reaching out to your advisor or again another research advisor to sort of talk about maybe somebody who's graded some of your research or worked with you in the past to say, if I were doing it again, what did I miss, kind of thing. So you made some excellent points
Exactly, because we always have in this part of, like future research, that we wanna do. One of the things that is important also, and me as a faculty member, I would like to share that experience. It's important to see how you are communicating, with potential collaborators, with potential, with your advisor, with people perhaps that that you want to do a postdoc at a specific university and you are highly interested in working with a specific professor. See how you are writing and you are communicating with this person. That's what is important to work on your emotion. So perhaps you're writing an email that is overly emotional, and it sounds more like demanding something rather than trying to collaborate. Read that person, research, and see in what way can I help to expand that or to provide more information or to make something more stronger. In your future, you're going to have at some point an interview. And I would recommend to practice on your own statement. Think about this part of your life in which, your work has been stopped, or everything that you wanted to do suddenly is not happening in the meantime. But how this experience is actually helping you to become aware about the potential that you have, things that you have not had the experience before to explore because of the time or because you were more focused on your studies, but now you have that opportunity. So maybe, this could be an addition, and you can talk about those things in your interview. I felt in this way when this happened, but this is what I learned from this situation, and this was helped me to move forward. And now I am here, so that I can, and I can share this with you. When I went back to my country for a period of 2 years, I had a similar thinking. I mean, it wasn't a pandemic, but I felt that since I was not physically here, I was not going to be able to make the connections, to continue my works, to continue producing. And I became really sad for a period of time. But then, I started doing things that actually make me a little bit more competitive in my own field. And, it might take more extra time for some people, but I don't think it is impossible. I think that people definitely can succeed, and learn a lot from this.
That's right. And I think recognizing your own feelings is and your own emotions is just so important, and using that to your advantage and using that in that interview and with your advisor, etc. We do have a question from the viewers that says, I'm having an extremely hard time myself trying to finish up my degree, which requires lab work, but also being a mom to my 2 young children. The pandemic has also cost me a job due to my extended timeline now. The depression is really making it hard to take action because everything feels so uncertain with no light at the end of the tunnel. How do I turn it all around?
Mm-hmm. Thanks for the question. So this is a very common, experience for many people who are in a similar situation, who cannot what I said at the beginning, they're dealing with different things in their lives. For example, being a mother and at the same time finishing a degree. we notice that sometimes there's no space, you know, so sometimes you have your children at the daycare, or you have your children at daycare, your children at the school, and you had that time in which you became overly productive and continue doing your work, continue doing your research. But now all of us, we are sharing a same space. You know, it is very important to create boundaries as is possible. I know each family is different. You know, each family might have other people who support them. You know, so it's different, for example, to be in a relationship in which you can rely in your partner, you know, to maybe take turns to being able to take care of the children, versus, you know, a person in which you have to do it all by yourself. Perhaps adjusting the time, you know, recognizing, for example, putting some schedules when possible, you know, in which one of the strategies, you know, like for example, like in my case, I have a child too, and what I noticed in my work is like I was also becoming overwhelmed about doing everything. So what I start doing it is just maybe at the very early in the day, for example, I decided to reply all my email, you know, if I could. So maybe adjusting the time. Right now it's very challenging to bring, for example, somebody to take care of the children, you know, or maybe to, I mean, the viewer has not give more details about, you know, if there is a support network that this person might have. You know, I don't know also the age of the children, because the age of the children also is kind of like important to see what strategies do I have available. You know, is this a child? I mean, is this a toddler? I have to keep my eyes all the time. But is this somebody, you know, a child who is a little bit older, maybe can be reading, or maybe the electronics that the parents allow, or watching TV, or doing another activity in which I have my time, keep them close, but I have my time to continue my work. It is extremely stressful moment, you know, but I think that number one, the try to keep some sort of connection or networking. I'm not sure how we are gonna progress here in churches. Eventually we will be able maybe to share those responsibilities with other people, or if daycares will be open, or we will have some other resources. Space is very important, you know, but again, the age of the children as well. So how old are the children? So since we know that what kind of resources we can use. If the person is dealing with some sort of depression, you know, so it's extremely important to try to seek help, you know, to try to seek help. Right now there are services by telehealth. So definitely that would be really helpful. Each person who experiences depression experiences it in a different way. So I would like to say, if you feel depressed, you have to do ABC, because we need to see if you know where the depression is coming from. So sometimes the depression come at the end when there are so many things that I feel like I cannot handle, right? Or I start feeling like less productive. So the person usually feel less motivated, does not really feel the pleasure, you know, that it used to feel in the past, or the person is perhaps not eating, or perhaps it's not sleeping properly, you know, or the person feels tired most of the day. So all these things can be addressed, you know, like in therapy. It's very important. It's part of your own self-care. So it's very important to have access to those services. I imagine that, I mean, I'm not sure, but I imagine that the UConn is still providing those services online as well, and perhaps that would be a good resource to use.
Yeah, and you're right. There are a lot of virtual counseling available. That's your area of expertise. You would know better probably than most, but I'm sure that help is out there. It's just it's hard to know, I think, for many people when they should go. So that's some good advice. some very good advice for our viewer. And so along those lines, Tatiana, do you see an increased need for your people in your field, an increased need? So for those who maybe just finished up their undergraduate degree or maybe finished up their master's and have an interest in therapy, in the therapy field, or in, you know, HDFS or sort of in your area, is it a good thing to pursue? And if so, you know, now is a hard time to get into anything new, but how would they start looking into the field if they're interested, or what can they do to enhance, you touched a little bit on it already, their skills to prepare them to get into the field when things open up a little bit?
To get into the field, I think the
therapist, yeah.
You mean any field?
No, into the field of therapy, marriage therapy, and sort of, do you see a need for more after this is over in going forward, or is it a good field to get into from a student perspective? Those who maybe have an interest in it, who maybe just got their undergraduate degree or their master's degree, is it a growing field?
Oh yes, it is a growing field by all means. You know, it's a growing field. There are here in Connecticut, I mean, there are so many agencies. The university in which I work, I mean, we work with different kind of agencies, with different agencies across Connecticut, and therapy is always is present. You know, there are so many families who have the need, family who have children, couples, etc. So it is a growing field. You know, the mental health services is always present, and I think that nowadays it's much more important. You know, so I think that it has a good future, and for people who want to become primarily clinicians, and for people who want to become also researchers or do their work in research. There is the field, our organization, the American Association for Marriage and Family Therapy, in that field, you know, so that there's an increase in terms of need, in terms of more research expanding in different areas. So most of the time we receive students from different fields. You know, there are people who are interested, who already have a background in psychology in general, but there is a different people in psychology. Sometimes people work most of the time with individuals, but in marriage and family therapy, you work with the system, you work with families. Sometimes you have 6, 4, 5 people, you know, in front of you, and it's a completely different dynamic than to work with one person, because each person has different personalities, and each person has different needs, you know, and sometimes not everybody agree on something. So that's kind of like, you know, the art that that actually the therapist needs to handle and to manage that in when working with families. Also, do the work with couples is a very fascinating area. You know, so nowadays we are hearing with all of these things that are happening. Many couples, for example, are struggling right now, you know, because of they start expanding their mind a little bit more into, you know, is this the person I want to be with, or this is a person that's perhaps not a good fit, you know, for me, or for I expect. Or there is other cases in which the relationship also become much more stronger. So there are different kind of dynamics. I think there is a very interesting field that, you know, for those people who are interested, you know, they can explore further. There's no other specific requirements, you know. I think that it's just more that passion of working with family, of working with couples, and working with children in general, that they can explore.
Are there some interim things they could do that don't require a PhD to be a full-on therapist, if there's an interest in, for example, our questioner who's who has 2 young children and can't finish the lab work, but lost her job. Is there something that that you can recommend that would keep them on that same path so that they're sort of in the same field, but they don't have the credential yet, but they're keeping themselves right up there?
Okay, so I want to make sure that I understand the question well. So the person is already is a clinician, or is going to be a clinician, right?
I think so. I'm not as familiar with the field as you and our questioner is, but they don't have the credential that they need to be a full therapist. They can't get the lab work done. They don't have a job right now. I suspect they probably need an income. So what area would you recommend they do to keep themselves up, to get a paycheck, and to sort of just manage through this to the point where then they can continue to pursue the degree so that they can have the credential and then become a therapist? Is there anything you can advise on that?
Well, yes. I mean, within the field, there are different kind of things that can be done that requires only a bachelor degree. You know, like sometimes there are assistants, there are people that work, for example, at the school, or people that work with, for example, providing some skills, you know, to the family, that sometimes visit the family's houses. And there are different kind of jobs that do not necessarily require, you know, the masters. And also do not require the license, because we cannot work without having a license. You know, I cannot do therapy without having a license. So, but there are other jobs that definitely that they can do to get paid for it, you know. And so usually those kind of jobs, they're not going to pay you as well as if you have the license, you know. But at least it's gonna keep you in the field. Actually, you know, we know many people, like, for example, they're doing different kind of job like the one that I explained already. And then they go and apply to the program, because actually the interaction with the families, the interaction with the children, you know, they discover they have the skills, or they have the capacity, or they have the interest. So they decide actually to get the full training to become therapists. So there are a lot of opportunity up there in many agencies, nonprofit organizations that there are here in Connecticut, that people can explore those opportunities and practice, you know, a little bit in the field without being a therapist. And then when the time is right, they can continue with their studies to get the training. Mm-hmm.
That's some great advice. You know, and I hope that it's helpful to our viewer. And please, if you need to talk to somebody, you know that there are lots of people on your team, and there are lots of people out here that care and are willing to help, and will do anything we can to help you. Tatiana, I want to also just touch, I'm going to back way up to our early part of our conversation, because it sort of touches on what you've been talking a little bit about, which is you got married in the middle of your studies, and how did that affect? So now it wasn't just about you, it was about, you know, someone else, and sort of, did you have the support you needed? And so just like balancing a family and young children when you're trying to do your research, you did have a spouse. So how did that play into your experience and training and research and sort of life experience? Did it make a difference? Did it help? Did it add stress? How did it affect?
You need to have a spouse?
Yeah, no, I mean, how the spouse affected your studies.
I think my husband has become a researcher at this point. Well, yes, I got married when I was finishing my doctorate, actually. I didn't have children at that time, and I remember I was in the middle of finishing my dissertation, you know, and pretty much I locked myself in a room, and I was writing all day long and trying to get it done. I would say that it's challenging too. Well, in my case, I went back after all of that, you know, to Peru. So there was this also separation during this period of time, because my husband, because he worked, he had to be here in the U.S. and I was there in Peru, and I had a baby, so it was very challenging, But I think that we kept a very good communication, and we were very intentional in trying to navigate these circumstances, and try to do the best we could. When I came here after that, so I had to manage, and I get a job here as a faculty member, and I had to manage my time, my time for my family and my time for my work. Being in a tenure track position, as most people might be familiar, it's very intense. There are a lot of commitments and responsibilities. So it was always something that I wanted to know. I have been very fortunate that I am in a relationship in which I had the fully support, of my husband. There has been times too in which, perhaps I had to devote or to spend a lot of time to the work that I have to do, and it's what it was at that moment. But I think that having this conversation and knowing what the goals are, what the priorities are, given having that support, that mutual support actually, because it shouldn't be about only one person's enhancing their own career, but it should be also about the other person as well. So we are in different stages, we have different career goals maybe, and how I play that part as well, so which I think in people who are in a relationship, I think that they need to communicate that clearly. What do I need from you at this specific moment in my life? And what am I gonna be able or willing to do for you? So how can I support you? You know that you can reach out to me when you need it. So kind of like what in therapy we do, the are you there for me? So accessible, to be a person who can engage with the other person, and talk about this frustration, because the reality is that there are going to be times in which it's not that you pick one or another, it's not that you pick your career or you pick your family, but there are times in which there's never a 50-50. People talk about we're going to do 50-50 and I'm going to be 50 here and 50 there. There are times in which it's going to be perhaps 80 and 20. And that's the reality, but how am I going to compensate that later on? So I think it's very important to pay attention to our own relationships as well. When we are in graduate school, when we're starting our career, so there is so much investment that we put in our career, which is good, which is great, because we're building up a foundation. But it's important also to keep the perspectives of, I'm with my career, but also it's important to have to pay attention to, the foundation of my own family. Yeah.
That's right. I'm sure you're right. It's not 50-50, and I bet it changes sometimes by the minute, right? Or at least by the hour.
Exactly. But it's important to have this discussion, because not everybody understands. So people might feel rejected, people might feel like disconnected. So it is important to have that transparency, in the relationship, and give the other person feel I wouldn't say the permission, but perhaps make the person feel confident enough, and the person feel good enough about saying, I need this from you, or I need you to do this for me, or I need to spend more time with you, or I need you to do this project with us, or anything, but the relationship should have that kind of dynamic. I really want to be able to tell my partner what I need to say. Sometimes it's not possible. Again, there are different kinds of couple relationships, but that's kind of like the desirable situation.
Sure. And I think it all goes back to what you said earlier of recognizing your emotions and knowing sort of where you are, and then sharing that with a spouse or a loved one. We're getting close to the end of our time here, so I welcome any other questions. But while people are typing in questions, if they have any, I just want to ask you, given that you're a faculty member, how can faculty, and you're not speaking for all faculty, I understand that, and we won't hold you to that, but and as an alum from UConn, what do you think in general? Are your peers open for alums to reach out and ask for help? And what kind of help could faculty offer? What do you think faculty's role is in helping their students to go on to the next level, or even get through the research frustration or stall or whatever people are situation they're in right now?
Mhm. So this is a very important question. I'm glad that you kind of like normalize the situation for me saying that I cannot speak for everybody. And it's true. I wouldn't do that. Um, First of all, I think that there are differences in the fields. For example, my field is all about listening and talking about emotions and processing emotions. But there are fields that have nothing to do with that. So, and it's not that it's bad. It's just that, I mean, the field has different things that they need to address. So for us, it's that because our field is about just exploring, diving in, talking about emotions and other aspects related to that. But there is a commonality, a common theme, I think, for our faculty. Most of us, we are here, we became faculty not only because we're interested in the research component, but we are interested in training people in their career, training people as a good professional, people who are going to succeed in that profession. And succeeding is not only about publishing or writing or presenting in a conference. It's also, have to do with how do you reflect your own self, so touching some specific part of your personality. And I think that all of that it's just this human part of us, that we want to be able to have an impact on our students, a positive one, as people that maybe we are motivated enough to continue our career, to explore new things in our career. And all of that, set up as an example, you are persistent, you're motivating, you care about your students ask questions, you answer those questions. So what I would say is to colleagues, to different faculty, take the time to listen to a student. Students communicate in different ways. Students are going to bring different things to the table. Sometimes some of them are going to be very emotional and some of them are going to be very rational. It's kind of like learning. We have different style of learning in the same way as our personalities. We have different personalities, different ways how we connect with people. Sometimes we might appear to be angry, but in reality we are sad or we are fearful. So let's take the time, to kind of like explore, with our students, or the students might come and appear, like demanding, I want to do this or I cannot do this, or why you didn't reply this, or I sent you this yesterday and I haven't heard from you in the last 24 hours and things like that. It's happened. And it's triggered faculty too sometimes, that's another reality. But we need to understand, as people who work in academia, that sometimes, so my experience of speaking now, I can recognize that that's not the usual way how my students approach to me, so there is something going on. So perhaps I need to put a pause in the conversation and ask, like, is there something that you're experiencing right now? So I perhaps noticing, I see you that, there's something different about the conversation this time, and I wonder if something has happened to you, or how do you feel about your research that has been postponed or has been canceled? I know that you might be feeling bad, or this might be a situation where you have other concern as well. How can we do, something that perhaps can move you in a different direction, or perhaps you can continue building, your skill or your competences in a way that you will become successful as well. So try to connect with the human part and not only with the productive part. I think as we give our students permission to do that, our students also will resonate with how we speak, and they will calm down, and we are gonna give them, you know, that space for them to become confident and creative and collaborate, you know, co-create, you know, a new ways of perhaps moving their research or exploring other topics or expanding on a specific topic they haven't had the time to do.
That's Well, I think you sound like the perfect compassionate professor. I hope that most professors look at it that way, but it's all about what you said right at the beginning, which is recognizing your emotions. It's not just your own emotions, though. In this case, it's recognizing your students' emotion. And for non-research, non-faculty relationships, it's recognizing your employees' emotions or others' emotions, especially at this time. Trying to be a little bit more empathetic or compassionate, I think, and I think that's where you were going, and having professors be a little bit, and just anybody in general, being just a little more understanding of where somebody's coming from. And I love that you talked about getting to know your students. Obviously, you get to know your students at the beginning, so you've noticed a change, right? So you said, and maybe I need to take a pause and realize that this isn't the way they normally react. So let's pause and explore that a little bit. So I think that's wonderful, and that's some really great advice.
You can validate their feelings, you know, you can normalize their feeling. I mean, you're not going to become their therapist, because we cannot do that, even in our field. I mean, we are not our student therapists. So if they need therapy, they might go to see somebody else, but we need to recognize that they also have their own stressors. And so we do, you know, as faculty, you know, whether if you start interviewing faculty, you're going to recognize that faculty are going through different situations that they need to handle as well, you know, and
yeah, that's great.
Relationship, etc. But for the students, you know, we are modeling as well how to being able to communicate, because eventually they will move on and they will be in charge of other people, and they will be handling people who are also experiencing emotion like that. But I think, you know, that at some point they might remember, you know, so I need to calm down my own self to being able to interact with others. So we are modeling, we're helping, you know, we're trying to adjust, and we learn with them. You know, we definitely learn with them. Now, it's important also to recognize that we might not necessarily be able to fix the problems, you know, but I think that's just to listening and to being able to acknowledge how they might be feeling. I think that that is very important, just to so that they feel validated by their professors.
That's great. You've given us some great things to think about, and I really appreciate your time. Makes me proud to be a fellow UConn grad. So thank you very much. Would you be willing, I'm putting you on the spot on this one, if students do have, our attendees have any follow-up questions, would you be willing to respond and help them out? Not help them in a therapist way, but just as a resource or someone to talk to. As a mentor or something. We have UConn Husky Mentor Network that we'd love to have you be a part of, and have our students be a part of as well.
Yes, thank you so much. Yes.
All right. Well, thank you. I want to thank all of our attendees today. This has been very impactful, I think, and very important to hear from Dr. Melendez Rhodes. So I thank you again. As mentioned, this webinar is a part of an ongoing webinar series on careers and issues in this pandemic environment, produced by the UConn Center for Career Development. Next week, we'll host Colin Mansfield, shifting gears a little bit. He's the corporate credit analyst at Fitch Ratings in Boston, and he specializes in research as well, but he specializes in research on the casino, theme park, fitness, boating, and travel industries for investors. So we may not be on the emotional side as much next week as we were here. Please check the Center for Career Development's events calendar at career.uconn.edu for more information about upcoming webinars and more resources for the job search. Once you leave today's webinar, you'll receive a survey on the presentation, and we'd appreciate it if you would complete that and provide your feedback. It will include a link to register for next week's event as well. You'll also receive a follow-up email within 48 hours with a link to view the recording of today's webinar. It'll also be available, that recording will also be available on the Center for Career Development's website. We're excited about sharing more career advice and perspectives from alums and other career UConn friends. On behalf of the UConn Center for Career Development and our guest, Dr. Tatiana Melendez Rhodes, thank you for joining us and enjoy the rest of your day. Take care. Stay healthy.
Thank you.